So we have finished regarding post-operative care. The next topic that is there in your syllabus is surgical drains and types. This topic is asked for 2 marks and for 5 marks. So you can see in the picture here, these are certain types of surgical drains. Okay. So what do you think surgical drains are? Surgical drains, as you can see here in the figure, these are certain tubes. Okay. They are some narrow tubes which are used to drain. Now what to be drained? Usually in the wound, there could be chances of collection of pus, blood, or sometimes fluids can be collected in the wound. So we have to drain this pus, blood, or other fluids most of the time. After the surgery, what happens is this pus or blood can be collected in the wound. So we have to drain these things. Okay. So only when drainage is there well, the wound will be healing properly. So that is why we are connecting a surgical drain. This is one type of surgical drain. Okay. So most of the time the surgical drains are installed by the surgeons or by the radiologist. They will see the correct site and then they will be attaching a surgical drain. Okay, so we will see the definition of a surgical drain. A drain is a tube that is used to remove fluid, air, or pus that is present in the site of the wound. Okay, so what and all type of fluids can be drained? Anything can be drained. It could be your blood, serum, pus collection in the wound also can be drained. If you are removing urine, any type of body fluids, okay, urine is removed, then also we can tell that it is a drain. It could be feces, bile, or even lymph. Okay, so remember, a drainage tube is used to allow the removal of fluid or air. Okay, now when I refer to fluid, it could be any type of fluid, blood, and any body fluids can be removed. Okay, like pus, urine, feces, bile, or lymph. The most common type of drain that we are using in the hospital is your urinary catheter, okay, or even your NG tube. These also are coming under types of drains. Okay. Next is indications. Now, why do you have a surgical drain? Why are you putting a surgical drain? Here you can see that there is a dressing, okay, and then the blood is being drained here, isn't it? Usually, the principle behind this application of drainage is most of the time gravity. By gravity, it will drain, okay, and most of the time by the capillary, okay, movement of fluid in the capillaries, that also helps in drainage of fluid. Now next is purposes. Why we are using a surgical drain? So as I have already told, surgical drains are mainly used to remove the blood, pus collection, or even it is used to remove any type of body fluids like urine, feces, lymphatic fluid. Okay, anything can be removed with the help of a drain. Okay, so whatever is there in excess, that can be drained out. And most of the time, why this is drainage is connected to the wound? It is mainly done to decrease the rate of infection, and it will also help in healing the wound. So these are the indications of purposes. Next is qualities of a good drain. How an ideal drain will be. Usually, an ideal drain is soft or almost firm. Okay, it should not be very firm also, or neither it should be too soft. Okay, if it is too firm, what will happen? It may cause damage to the surrounding structure, okay, or tissues. And next is ideal drain should be smooth. It should not be very hard. Why it should be smooth? So that it can be efficiently used and it is easy to remove. Next is the ideal drain should be sterile. Okay, whenever you're introducing the drain, it has to be done in aseptic technique, in a sterile technique, so that there is no introduction of infection. Next is ideal drain should be stable. It should be non-allergic. Next is it should be very simple so that the patient and the staff can manage well. Next is moving on to indications of drains. We have got different indications. Already I have told about certain indications of drain. These are some other indications like for therapeutic purpose, diagnostic purpose, prophylactic, monitoring, palliative. Okay, we'll see each of it in detail. Therapeutic means for treatment. Now, if the patient was having tension pneumothorax, most of the time there can be accumulation of air in the pleural space. Okay, because of the pressure, air can be accumulated in the pleural space and it is a life threatening condition. So in case of pneumothorax, to remove that excess of air which is present, you can use drain. Okay, most of the time we are using this chest tube drains. Okay, intercostal drains we tell. Then sometimes we also use drains to remove excess of pleural fluid. If excess accumulation of pleural fluid is there in the pleural cavity, that is usually seen in pleural effusion. Okay, in that case also what you can do is you can use drains. Next is if the patient is having abscess. Abscess means pus collection in the wound. In that case also we can use drains. Next is diagnostic. Diagnostic means again for finding out, for diagnosis purpose. Okay. For example, if the patient is having any renal stones, that time also we can use a drain. We can find out what is present inside the tissue. Okay. To find out what is present inside the tissue, you can use a drain. Okay. Here, most of the time, whenever there is any retained gallstones and all, or by biliary stones are present, we usually will use drains. Okay. Next is prophylactic. Prophylactic is usually here for treatment itself. For example, it could be certain surgeries like after thyroidectomy. Thyroidectomy is removal of thyroid gland. After thyroidectomy, what happens is there can be excess accumulation of fluid or air or blood. So to remove that, you can use a drain. Thoracotomy. Thoracotomy means it is the opening of the chest. Now, most of the time we open up the chest in case of lung cancer and all. Okay. So thoracotomy, after thoracotomy also what happens, there can be excess accumulation of fluid or blood in the site. So to remove that, you can use a drain. Then other surgeries where you will be using a drain are splenectomy. Splenectomy means, ectomy means removal. Okay. Splenectomy is removal of the spleen. Pancreatectomy. Pancreatectomy means ectomy is removal. It is the removal of pancreas. Esophageal resection. Okay, suppose a patient is having esophageal cancer or there is polyps and all, you will have to remove a part of the esophagus. Okay, that is called as esophageal resection. In that case also, after the surgery also, you can use this method. Okay, you can use drains, or even after any cardiac surgeries and all, what happens is it is very necessary to drain the excess of air or blood, so you can use the drain. Okay, and other than that, as I have already told, if there is GI bleeding in the sense excess of blood accumulation may be there in the stomach and all, so you can do the GI aspiration through the drain, that is through NG tube. NG tube aspiration will be there. NG tube feeding, not NG tube feeding, it is NG tube aspiration. You're removing the excess of fluid from the stomach. Or urethral catheterization. In urethral catheterization, why you are performing? To remove the urine, isn't it, from the urinary bladder. So that case also you can use a drain. Advanced CA esophagus. Okay. Already this I have mentioned. Hydrocephalus. Hydrocephalus is actually fluid buildup in the brain cavity. Okay. In that case also you will be using a drain. It is actually a type of internal drain. Next is classification of drains. Drains can be classified into open or closed, active or passive. Rubber drains are there. Rubber drains are also called as elastic drains. Internal and external drain, and drains with suction and without suction. And some other special drains are there like chest tube drains, T tubes and guided drains and all. Okay, so we will see regarding these types of drains now. First one is open drains. Okay, so open drains you can see here in the figure here. Okay, so this is a type of an open drain. Usually they are rubber or plastic type of sheets. Okay, and this fluid collects into the gauze pad or into the stoma here. Okay, and this open drain, since it is an open type, there is increased risk of infection. Example is Penrose drain. Okay, I'll show you the figure of Penrose drain later. It is a type of open drain. Next is closed drain. So this is an example of a closed drain. It is a hemovac drain. So closed drain, it consists of tubes draining into the bag or bottle. Okay. So one end of the tube will be in the wound, other end is a bottle or a bag. In this bag, what happens? The excess of air and the body fluid will collect. Commonly, closed drains are used for chest and abdominal surgeries. After chest surgery or after abdominal surgeries, we can use this closed drains. Example are Jackson Pratt drain and Hemovac drain. Okay, Jackson Pratt drain, I'll show you in the figure later. Okay, so this is the first type of drain, open and closed. Open drains are actually open type, so there is increased risk of infection. Example is Penrose drain. Closed drains means one end of it is there in the wound while other end is in the bag or bottle. Okay, there is less chances of infection. Next is active and passive drains. Okay, so active drains are usually having negative pressure, and commonly this passive drains will be maintaining in a normal pressure, and because of this negative pressure, usually active drains high chances of obstruction. Okay, while passive drains less chances of obstruction is there. Okay, we'll see it in detail. So we have got passive drains. So passive drains commonly don't have suction. Okay, they don't have suction. For example, your NG tube, Foley's catheter, okay, and T tube. These are all examples of passive drains. Okay, and some other examples are there: Penrose drain and corrugated drain or rubber drain. Okay, so remember, passive drains are actually without the suction. Under passive drain, again we have got closed and open type. Okay, so need not remember these two types again, but remember the examples of passive drain: NG tube, Foley's catheter, which is used to drain the urine; T tube, Penrose drain. Okay, so passive drains don't have suction. Next one is moving on to active drains. Active drains work with suction. Okay, they work under suction, and usually this active drains may have negative pressure, that is low pressure, or sometimes very high pressure also. Okay, so under that we have got examples closed and open also. Okay, so under the closed type we have actually got Jackson Pratt drain and Hemovac drain. Okay, and open we have got the sump drain. This is a sump drain. This is actually the Jackson Pratt drain, and Hemovac drain picture I have already shown in the previous figure. Okay, so remember we have got first one I have told is open drain and closed drain. Open drain means it is open but increased risk of infection. Closed drain means it is closed in a bag and all. Okay, there is less risk of infection. Next, I have discussed about active and passive drains. Passive drains work without suction. Okay, that much is more and enough if you remember. And remember, passive drains, they work under normal pressure. Then active drains work with suction. They usually are of low pressure or high pressure. This is an example of rubber drains. These are only the pictures here. Okay, you can just see the pictures. These are the examples of rubber drains. This is an internal drain. Okay, external drains which you have seen in the previous figure, no, all are external drains. This one is internal drain. Usually when there is hydrocephalus, excess accumulation of fluid, what will happen in the brain? You have to drain the excess of CSF fluid. Okay, so for that you are using a internal drain. Okay, so it is an example of internal drain. So remember, internal drain means they are present inside the body. External drains means they are present outside the body. Okay. Now, I was discussing so much about certain names, isn't it? So we will see these types. First one is Jackson Pratt drain. Jackson Pratt drain, this is a Jackson Pratt drain. Okay, you can see here in the figure, it is having a bulb, a plug, tubing is there. One end of the tube will be present inside the wound. Okay, so you will see usually this type of patients in the hospital. Sometimes examiners can ask which type of drain it is. Okay, so this is a figure of the Jackson Pratt drain. Usually it is used to remove the fluid after the surgery. So excess of fluid is accumulated, I told, after the surgery. So to remove that, we will use Jackson Pratt drain. Commonly, we are using it in abdominal surgery or breast surgeries. Okay, so this is also the same figure. Sometimes it is also called JP drain. JP means Jackson Pratt drain. This one is a most common type of drain that you will see in the hospital. That is a hemovac drain. You can see it here in the figure. Hemovac drain. Okay. So this is how you will be emptying the blood that is collected in the hemovac drain. One end of it will be present in the wound. Okay. And all the blood, air and all will collect inside this bag. Okay, so you have to press that drain, you have to press that bag and you can open it, and then you have to remove the blood that is collected inside the drain. So once you're removing the blood, what you have to do is you have to close the cap. Okay, so that is an example of hemovac drain. Usually it is done to drain the blood. Next example is Penrose drain. So this is an example of a Penrose drain. Okay. So this Penrose drain, you can see as here in the figure, it is a soft rubber tube. Okay. It is a soft flexible rubber tube, and this is used to drain or prevent the buildup of fluid in the surgical site. It is an example of open drain. Okay. So this is an open drain, Penrose drain. It is soft and having a flexible rubber tube, okay, to drain, or it is usually used to prevent the fluid buildup after the surgery. Next is some special type of drains, T-tube. T-tube already I have told. T-tube is commonly used after your gallbladder surgeries and all. Okay, it is in the shape of a T. That is why it is referred as a T-tube. Okay. Next is chest drains. Now, chest drains are usually referred as intercostal drains. Commonly, whenever there is any pneumothorax, hemothorax, that is excess accumulation of blood in the pleural cavity, or if there is lot of fluid accumulation, in all these cases, what you will do is you can use a chest drain. Okay, so they will be inserting the needle, okay, in the pleural cavity, and all the excess of fluid will be accumulating in the drainage bag. Okay, in detail, you will study regarding intercostal drain in respiratory system. Okay, remember that. But this is also a type of drain. Okay, it will remove all the excess of air, fluid, or blood from the pleural cavity. Next example of drain is NG tube. Now, this I need not explain. Nasogastric tube. Okay, nasogastric tube is mainly done to aspirate your food contents from the stomach. Next example is urinary tube, Foley's catheter. No, this Foley's catheter or urinary tube is also an example of a drain. It is used to drain out the urine. I hope you are knowing about the Foley's catheter, isn't it? Initially, when you are inserting the catheter, what you have to do? You have to insert some 5 to 10 ml of sterile water so that the balloon will be inflated, isn't it? When you want to remove the urinary catheter, what you will do? You will be removing that water so that the balloon will get deflated and you can remove the urinary catheter easily. Okay, so this is a part of that. Next example is pigtail drain. This is an example of pigtail drain. Commonly it is used to drain the pleural fluid, and sometimes it is also used for this nephrostomy, especially in case of kidney conditions and all, we can use this pigtail drain. Next one is care of surgical drain. How to take care of the surgical drain. Now, most of the time, you have to provide adequate care whenever the patient is on drain. So, first of all, when you're inserting the drain, usually it is done by the surgeons. It will be done safely. Then next is the surgeon has to see that it is done in aseptic technique, okay, in a sterile manner. Whenever they are introducing drains, it has to be done in a sterile manner. Next is see that the drain is not having any kinks and all. Kinks means it will not bend. There is no bending or there is no debris or clots in it. Okay, and then most of the time the drain should reach the deepest and most dependent part of the wound, not that it is superficial. If it is superficial, the air or the blood will not be collected in the drain. Okay, so it has to be located in the deep part. Next is You have to secure the drain well. Why you have to secure the drain is, sometimes if you don't secure the drain well, chances are there that this drain will fall. Okay, so secure the drain well. Usually you will put the tube and then just suture it to the skin. Post-operative care. So once drain is already present, what care you should take? So first of all, the wound around the drain has to be kept clean and dry. So frequently you have to perform wound dressing in aseptic technique. Okay, see that there is no infection around the wound and there should be no skin irritation. Then you can also apply some gauze also around this drainage tube. Then you have to remove the blood that is collected in this drainage bag. So most of the time, every day early morning or you can collect this drain. Okay. So you have to measure how much amount of drain is present inside, and you have to record it also in the nurse's record as well as in the intake output. Okay. So see that at least once a day you have emptying the drainage bag. Okay. It should not be overfilled, isn't it? Next is when to discontinue the drain, when you will remove the drain. Now, regarding the removal of the drain, it is decided by the surgeon. Okay. Usually, when the output, that is when the drainage output is less than 25 to 50 ml, okay, per day, when the drainage output is less than 25 to 50 ml per day, what you have to do is you have to remove the drain. The doctor will come, the surgeon will come and they will remove the drain. Okay. So this is just the information regarding the drain removal. It is not necessary. Next is regarding the complications. Okay. Now the complications of drainage. When you are having a drainage tube, there are certain complications, especially if you are not taking adequate care of the wound or if you are not taking adequate care of the drain. In that case, it may result in complications. Sometimes the wound may not heal if the patient is having diabetes mellitus and all. Okay. So the complications are divided into two types, immediate complications and early complications. Immediate complications is immediately once you have put the drain, patient may experience pain, irritation and excess of bleeding. If you are not putting the drain in a proper manner, chances are there that there will be injury or perforation to the nearby organs or tissues. Okay. Next is early complications. Early complications could be occlusion because of a blood clot or anything else that could be occlusion. Sometimes if the drain is not attached properly, chances are there that it may leak. Okay? So around the wound there will be a lot of leakage or there could be displacement of the drain from the wound. It may come out. Okay? And if you are not doing the wound dressing in aseptic technique, it may result in infection. Okay? So what will happen is if there is excess of drain collected in the drainage bag, the patient may have dehydration. Okay? So when they have dehydration, they can have loss of fluids and electrolytes. Next is late complications. In late complications, chances are there that after infection has spread, there could be complete death of the tissue. There could be necrosis. Sometimes there can be also fistula formation. Fistula means abnormal connection between two organs. Okay? Fistula can form whenever there is infection also. And scar tissue may be there or hernia may also form. Okay? So hernia is a protrusion of the organ. Okay, so these are some late complications. Okay, so these are the same things. Complications during removal is also same here. Need not repeat it. Next is assessment. What care you will take of the wound? First of all, you have to assess the drainage site every day. You have to assess if at all there is infection of the wound, there is redness in the wound, whether there is pus collection, leakage is there, and again, how you will know that there is symptoms of infection in the wound. Most of the time, whenever there is any infection of the wound, what happens is the patient will have redness, warmth, fever will be there, and excess of pain may be there. Okay, so that may indicate that there is infection in the wound. So immediately you have to visit the surgeon and they may provide with antibiotics. Then wound dressing may be done in aseptic technique. Next is ensure the patency of the drain. I told already about this. Drain is connected usually to remove the blood they can get occluded. Okay. So frequently you have to check the patency of the drain, see if at all there is any knots, whether there is kinking of the tubing. That also you have to assess. Next is always perform the wound dressing in aseptic technique. Okay, and then drainage has to be documented. Initially, you can document it every 4 hours, but at least once a day you have to monitor the take output. Okay, how much is collected in the drainage bag. If there is excess of drainage collection, you have to inform the surgeon. Then clean the drainage site every day. Okay, and usually you have to see that patient is not having any symptoms of infection. Okay, so this is also an example. This is actually a type of hemovac drain. See how they are emptying the drain. Okay, they are pressing this bag and then the blood is collected in the measurement cup here. They will measure how much amount of blood is collected or fluid is collected. Okay, then they will put the cap here. Okay. Frequently, you have to see that air is not entering inside. If a lot of air is there, usually blood will not be collecting well. Okay. So measure and then record it in the intake output and nurses record. So this is particularly about surgical